Migraines can be disabling. With symptoms so severe, all you can think about is finding a dark, quiet place to lie down. Nearly 1 in 5 women and 1 in 15 men have experienced a migraine. In some cases, these painful headaches are preceded or accompanied by a sensory warning, aura, such as flashes of light, blind spots, or even tingling in your arm or leg. Migraine is also often accompanied by other signs and symptoms such as nausea, vomiting, and extreme sensitivity to light and even sound. Migraine pain can be excruciating and may incapacitate you for hours or even days. Hello and welcome to Healthy Connections. I'm Annetta Wilson, your host. Healthy Connections is a show dedicated to exploring a wide variety of topics, from prenatal care to Alzheimer's disease. And we do so with a wide variety of perspectives, from the professionals who help treat the syndromes to everyday people like you and me who may have personal experience dealing with these topics on a first-hand basis. Stay tuned for Healthy Connections. We're joined by Amanda Lang, a physician assistant in neurology at Orlando Health. Now, she specializes in helping patients manage migraines, one of the most common and disabling types of headaches. Amanda's going to share what sets migraines apart from other headaches, common triggers, and the latest options for treatment and relief. Welcome.
Thank you for having me.
When is a headache a migraine, and when is it just a headache?
So a headache is a more broad or generalized term to describe any type of pain in the head. Most people are going to suffer from a headache at some point in their life, and this is something that can be treated with rest, hydration, or over-the-counter medications. What makes a migraine different is that it's a very specific type of headache disorder that not everybody is going to suffer from. In fact, 18 to 21% of women, so roughly 1 in 5 women, compared to 6 to 11% of men, so roughly 1 in 15 men, are going to suffer from migraines. And the reason why we have those numbers is because migraines are genetic.
Genetic.
Yes.
So some people are just the luck of the draw, so to speak, will end up getting, even if you have a genetic predisposition, does that automatically mean you're going to suffer from migraines?
Not necessarily.
Okay.
I have a multitude of patients that they're maybe the first in their family to suffer from migraines or that they know of. We don't express every gene that is passed down to us, and statistically when one parent has migraines or has the genetic mutation for migraines, there's a 50% chance their child will suffer from migraine at some point in time. 2 parents having migraines, 75% chance their child may develop migraines.
And what is the youngest you've ever seen someone with a migraine?
The youngest I've seen, in speaking with colleagues and patients of my own, can even be as young as 2 years old.
Oh, wow.
Yes.
So how do you know? What are the signs and symptoms you look for? Because, you know, I've had horrible headaches, and I think once the headache is bad, you go, am I having a migraine? But what are the specific things you look for, and what are triggers?
So a migraine is characterized by an intense pounding, pulsating, throbbing like sensation. Usually it's going to happen on one side of the head, but can happen on both.
Okay.
And it's associated with other neurological symptoms like sensitivity to light, to sounds, smells, movement. Sometimes people get nauseous with their headaches, and these episodes can last hours or sometimes days for certain patients.
Do you feel it coming on, or is it the sudden onset?
So when we talk about migraines, I explain that it's a brain event. It's not just a headache. A headache is just a symptom of the migraine. And that's what most people are going to come in for, because that's the thing that's most disabling for them. But if we're paying attention to specific signs and symptoms that are happening to us before the pain sets in, then yes, you can kind of even predict that a migraine has started and a headache is coming.
So what are the things we should look for?
So this phase is called the prodrome phase. Not many people know about it, but it's super important, and I educate patients so much on it because this is an ideal time to treat it with acute or rescue medications. So some signs and symptoms you can pick up on before your headache starts could be maybe the light sensitivity, sound sensitivity, nausea, like I mentioned, but even neck pain. A lot of people suffer from neck pain, but neck pain is actually the second most common reported symptom that people with migraines suffer from.
Wow.
Dizziness, lightheadedness, changes in your mood, difficulty concentrating or reading, with comprehension, with speaking, food cravings.
Oh my goodness, there's so many things. How do you know when to call you?
So, and it's hard, especially for people who are suffering very often from migraines. I have so many people that I pull up that chart for them and they're like, well, that looks like my life. And I say, well, then we need to treat that.
Right, so let's talk about treatments.
Yeah.
What are the treatments you're most excited about now?
So after 2018, that's when we had a surge in a bunch of these newer medications. And when I say newer medications, these are medications that are specifically designed to treat migraines.
Okay.
Prior to that, we had a bunch of older medications. These medications we typically were originally designed to treat high blood pressure or depression and anxiety or seizures. We still use those, but not as commonly anymore. We liked using the newer meds.
Are they prescription only? Is there something over the counter that you recommend?
So over the counter medications, like I mentioned, could help with those tension headaches or, those headaches that you have every once in a while. But when patients are starting to have more frequent headaches or the severity is intensifying, that's when we usually say, talk to a healthcare provider because that could mean your migraines are worsening or something more serious is happening.
What about the folks who say, I'll just power through it? I can tell by the look on your face. You've run into a few of those?
A lot of migraine sufferers I hear this all the time, that they have such a high pain tolerance, and I don't doubt that. I know they do. But just because you've been suffering with headaches and this pain your whole life does not mean you should continue to do so.
There's no prize for that.
No, there's no prize at the end of this. And in fact, the longer you go on not treating your migraines, they can worsen as time goes on.
Could they be fatal or lead to something fatal? And I
Migraine-
know that might sound dramatic, but
Yeah, no.
someone may be wondering that.
No, of course. I mean, that's important. And migraines are not fatal. This is a chronic condition that most people will live with most of their life, and there could be ebbs and flows. Some years may be better, some years might be worse. But I try to encourage patients, treat this as serious as you would your hypertension or high blood pressure or diabetes. Why does your provider put you on preventative medications for those disease processes? So you don't have a heart attack or a stroke. I educate patients, get started on a preventative for your migraines so that you prevent disability. Because migraines in this country is one of the top leading causes of disability, especially among women under the age of 50.
That's a pretty startling statistic because that's a large group of people, women under 50.
Yeah.
Success stories?
I have so many success stories, and the thing about treatment with migraines, I always set expectations with patients. My goal is to get you headache free. Is that always possible? No, but I'm going to do my best to get us there. And it takes time. I've had patients that after their first appointment, we found the right medication cocktail for them, and they're great. They're going back to living their normal lives. They can go to work, they can attend family and friend functions. Everything's great. Sometimes it might take months, couple years to find out what best works for you, because every patient is so different.
But to get to that point, you have to get started, and that means calling someone like you.
Exactly.
Thank you for that, for everything that you're doing, and hopefully shedding some light, not in a bad way if you suffer from migraines, on a bigger problem. We'll be back right after this. We learned a a lot today about migraines. A headache is often not just a headache. What's important is take your symptoms seriously and ask questions, because we want you to be around to continue to make healthy connections. I'm Annetta Wilson. Thanks for joining us.